Hi, I'm Dr. 𝗏𝗏𝗂𝒏 with Chiropractic and Sports Health with Austin, my assistant today. Talking more about the hip and specific muscles that might be associated with your pain and how you can do a little home management of alleviating some of that discomfort. So within a muscle there can be sometimes things called trigger points, which are these little nodules of muscle that become strained and inflamed, and so they become sore. You can press on them, it might radiate some pain. You can almost feel that little knot is what people typically refer to as trigger points. So it is a therapy that we'll often do with patients is to help find those trigger points and teach methods to alleviate some of that trigger point related pain. In the hip, there's a multitude of different muscles that might be attributing that and have trigger points. And so the first key is to find out where those are. So I'm going to show you 3 common trigger points right now. At home, all you need is something like a golf ball or a tennis ball to work it out. So what we're going to do is we're going to find the first one here. We're going to go into a muscle called the 𝒟𝒂𝒊𝒏𝒈. So first, there's these little bony nubs you can find in the back. Those are your sacroiliac joints. If you go off that nub just a little bit out and then down, right in this region, the belly muscle is the 𝒟𝒂𝒊𝒏𝒈. And so you may be able to search around there and find a little knotted spot. At which point, that's when you take your tennis ball. You can even get in there, apply a little pressure, and just do a little circular motion on it. Holding that for about 30 seconds and just slowly rocking it out and seeing if that gives you alleviation. Not too far from there is another muscle called the piriformis. The piriformis is if you find the little bony prominence on the outside of your hip and then go just back in, that piriformis lies right along that part of the glute. Pretty common muscle that's involved in a lot of hip discomfort. Again, you could take that tennis ball, you can work into it, just apply a little pressure in there and start rocking that if you find that sore area. You might need to track along that piriformis to find out exactly where it is, but it could be somewhere along that line. So that's 2 of the muscles on the back. The third one's going to be on the front side. So Austin, if you'll lay on your side facing that direction. So the third trigger point we're talking about today is in what's called the tensor fascia lata, or TFL for short. So again, if you find that bony prominence on the outside of the hip, and you may find that little ridge of bone up top here. If you were to go about halfway in between them and a little forward, and you come right down in here, you may find another little sore spot that's in that hip flexor. And again, you could use your thumb or you could use a ball and just kind of apply a little pressure in there, find that trigger point, and just slowly work it out in there. That might help loosen up that as well. Now those are nice methods to try on your own. There could be other things involved here with the hip pain that might be attributing to your pain. And so determining what that is of course very important. So if you're having discomfort here, give these a try, see if that helps some. If not, give us a call. We'll be happy to help you out.